Morning everyone. My close friend doctor has asked me about the physiology of carbohydrates and physiology and metabolism of carbohydrates. Basic physiology for all the doctors. This slide is very important, not only for doctors, for everybody. Why? Because in a college still we are teaching students that carbohydrates are looked after by insulin and proteins are looked after by growth hormone and lipids are looked after by are managed by lipase and other enzymes. This is a fundamental mistake. That is the reason why even super specialty doctors, some few endocrinologists, diabetologists, cardiologists, they are not knowing this one basic point. In medical college 40 years back, we were taught that glucose was controlled by insulin, protein was controlled by growth hormone. Even now the same continuation of education is being given to the students, and later on after doing their specialty and all, they are unable to understand this basic problem. The thing is, last 5 years it has lot of changes happened in the medicine. Now the thing is, anything, whether it is a glucose or protein or a lipid, they are all controlled by insulin. As you can see here, those people who have stopped taking a lot of fat diet but they increased the carbohydrates, they found getting heart attacks again. This was the most surprising thing. Why? Because once you are reduce your fat, what you think you are having no fat in the body, so you will not be getting a heart attack. Your vessels will not be blocked. But now we found out that glucose can be converted into fats, and this can be converted into blocks in the heart. So this fundamental control of glucose, lipids and proteins are by insulin hormone, which is released our own body. When we talk about insulin, I mean the insulin that is produced our own body, consumed by our own body. This is the fundamental. So whether you are a medical professional or outside general public, everyone must understand. This is after age of 50 or 60 years, minimum anatomy and physiology every Indian must understand. This otherwise we are on one side the technology is going too high, on the other side the price of medical treatment is going high, and there is a lot of confusion among the public. And because of that, what happened, as you can see in this slide, everything is being metabolized and converted into fat and stored in the fat. So one few people, they think whenever you have because we are giving only lipid, like one keto diets they are giving, protein diet they are giving, they are adding oils. There are some people, they are telling because there is no sugar in the protein, you take whatever amount of chicken, you can take whatever amount of meat. And one person in AP, he went on selling coconut oil to public, saying oil doesn't have glucose, and people went on consuming liters and liters of coconut oil. The price of coconut oil has jumped from 70 to 7,000 rupees. And somebody said you take millets price have gone up. This is a fundamental mistake. Why? Because we don't understand the physiology. So every Indian must have some basic anatomy and physiology. It is not only related to doctors. And unfortunately, in medical college, we have stopped teaching metabolism and applied and physiology. So a lot of doctors, they don't know the basics. The fundamental basic is all the three, whether it is a carbohydrate, protein or fat, are controlled by insulin. Insulin is one hormone which is produced in the body, which will look after the entire system. So insulin resistance is nothing but once the patient went on eating again and again, our muscle will stop taking the glucose inside. This is called as insulin resistance. It can present only as heart attack. It can present only as hypertension. It can present only as diabetes, or it can present as a PCOS. So the fundamental is insulin resistance. Insulin resistance is fasting insulin to fasting blood sugar divided by 405. This is a formula. If it is more than 2, it indicates that we are developing insulin resistance and our body is converting all that we are eating into fat.